Welcome to our third community classroom of this year. For those of you that have attended in the past, you know that this is an opportunity for you to learn from some of our brilliant specialists that work here at Temple Jeans campus. Today, we're fortunate enough to hear from Dr. Willard Kasoff, who is the Director of Stereotactic and Functional Neurosurgery at Temple Health System, and he'll be covering deep brain stimulation. We are very fortunate enough to have this opportunity funded by the Anna T. Jeans Foundation. And obviously we are still hosting this one virtually, but we are hoping to begin doing these in person again in the fall. So fingers crossed for that. So with that, I'm going to hand this off to Dr. Kassoff, and you can go ahead and take it away.
Okay, Liz, thank you so much. And just to confirm, you can hear me okay?
I can hear you great.
Okay, so thank you so much for having me. Thank you, everybody. Please feel free. I think Liz is going to monitor the chat at least a bit. If anyone is Zoom technologically advanced and can send something in the chat. Otherwise, we'll open everything up for some Q&A at the end. I know that's really important to everyone. And I just found out that I'm only talking for about 20 minutes or so. So I'm going to try to get everything that I usually say into about 20 minutes. This may be a little bit like drinking out of a fire hose. So please feel free. We can go back and talk about anything. As Liz said, my name is Willard Kasoff. I'm a neurosurgeon here at Temple. This is my life history in a nutshell. I'm from the East Coast. I was recently at the University of Arizona for about 8 years. I'm a second generation neurosurgeon, and I operate on conditions that are neurologic conditions of the brain. So in this case, we're talking about movement disorders, Parkinson's disease, and essential tremor. But I also operate on patients with epilepsy and with pain. I think of myself as a teacher and a learner. We do teaching here at Temple, but I'm really very focused on patient care. The thing to say about our program, and Liz will have links for this, and I'll put my information down at the end as well. I see patients at Temple, Maine and at Jeans. We do see patients with telehealth. I'm more than happy to see patients from any health system, including outside Temple, and I'm more than happy to see patients whether or not you think you are ready for surgery, interested in surgery, or just curious and want to ask questions about surgery. So what would I like to cover in the next 20 minutes? So I want to talk about deep brain stimulation, which we call DBS, what it is, who's a good candidate for it, a little bit about how we do it, and about what results that we get when we do it. So what are the benefits that we expect to get from DBS, as well as what are the risks of the procedure. And then obviously want to leave time for everyone's questions, and I'm happy to stay as late as anyone else wants to stay to talk about things. So the audience for this, the only other thing to say is I'll mention some of the device companies that make deep brain stimulators. I have no financial relationships with any of them. It's not at all on our radar screen. I implant whatever device is right for the patient. Okay, so the group here, and I'm curious at the end how many folks are here with PD, Parkinson's disease, or family members with Parkinson's, and how many are here with essential tremor or ET. Deep brain stimulation is a treatment for both of those things. We call it kind of like a brain pacemaker. It works in the brain in a similar way to the way pacemakers work for the heart. And what we mean by that is people with Parkinson's disease and people with essential tremor have some of the rhythms of the brain that are beating at the wrong rhythm, if that analogy makes some sense. So the rhythms of the brain are off, and that's what causes some of the symptoms of the disease. For Parkinson's, it's the shaking, the stiffness, the slowness. For essential tremor, it's just the tremor, bad shaking of the arms usually. And what deep brain stimulation does is it helps to correct those rhythms in the brain and helps the brain cells to work together in the right way and helps control your symptoms. So what this is, and I'll show you sort of physically what the system is 3 parts. There's, hopefully you can see my arrow. There we go. Hopefully you can see my arrow now. There's the thin, soft wire that goes into the brain. There's the pacemaker down here in the chest. And then there's the extension wire that goes between them. Okay, so wire in the brain, extension wire, and pacemaker or battery in the chest. That wire or lead goes into very specific, very precise spots in the brain. They're different for Parkinson's disease and essential tremor. I'm going to do my slides slightly out of order. For Parkinson's disease, what are the things that we can expect with DBS? The things that DBS helps with the most are the following parts of the disease. Number 1 is tremor. DBS is very, very effective at treating tremor, shaking, in Parkinson's disease and in essential tremor. In essential tremor, shaking is the only part of the disease for most people. In Parkinson's, there can be many, many other parts of the disease, as I'm sure many of you know. Deep brain stimulation helps in general with the movement parts of the disease. What I mean by that is the shaking, the stiffness, the slowness, and can also help with some of the side effects of medications for Parkinson's disease, and with some of the ups and downs of the medications that some people can have. So these things here on the left, the tremor, the stiffness, the slowness, what we call dyskinesias, which are some abnormal movements because of the medicines, and the ups and downs with medicines that many of you are probably used to, the frequent medication, the having to take it suddenly, the medication wearing off, all of the problems with levodopa and with Parkinson's medications can really be not always totally fixed, but very much improved with DBS. In Parkinson's disease, what are the things that might get better? Okay, that I say to patients, maybe 50-50 that this will get better or not get better. Walking, how much medication you need to take. Pain in Parkinson's can sometimes be a very big part of the disease and can sometimes be improved with DBS. Sleep will often get better, although, again, these are the things that are kind of 50-50. And then what are the things, this is also very important, what are the things that we should know don't improve with deep brain stimulation? And the number one and two things there are balance and thinking and memory. And that's probably the biggest thing that is part of PD that at this point in 2022, we, unfortunately do not have a good treatment for. Deep brain stimulation is focused on quality of life. And so for many people, treating just the movement and the motor parts of the disease is an extremely valuable quality of life improvement. And that's and that's really part of the take-home message from tonight. So when we talk about who is a deep brain stimulation candidate, who's the right person to consider DBS? Okay, so here are the most important things. In Parkinson's disease, we want to be sure that someone has a clear diagnosis of Parkinson's, that they have mostly the movement symptoms that we talked about, that those symptoms do respond to medicine, although the exception to that is tremor. If tremor does not respond to medicine for Parkinson's, it can still get better with DBS, and that's an important thing to know. And lastly, that if someone's symptoms are not 100% controlled with medication, or that taking medication is a burden, or the side effects of medication are a burden. This line here at the bottom is really my summary for patients with Parkinson's of who is the right person to talk to someone about deep brain stimulation. And it is, if you have Parkinson's, and if the movement symptoms of the disease, the motor symptoms of the disease, again, meaning the shaking, the stiffness, the slowness, the walking, if those things are not controlled to your satisfaction, those things are not fully controlled with your medications, DBS will probably be helpful for you. And DBS is absolutely something to think about for you. Who are the folks for whom DBS is not necessarily the best choice? Who are people who may not benefit from surgery? Probably the main thing that we look for is someone who has severe memory problems or severe thinking problems, or even dementia from Parkinson's disease. Someone who has really bad balance problems, someone who has really bad psychiatric or emotional problems. Those are often less good patients, or patients for whom DBS does not work as well. Although I should say that everybody with Parkinson's has some depression, and everyone with Parkinson's has some amount of anxiety, and those things are completely normal. And so I'm really here talking only about very, very severe depression or anxiety that can't be treated or is not under control. So the bottom line is that most people who have, I'll go back here, most people who have Parkinson's, who have motor symptoms not under control, are going to be possible DBS candidates. With respect to essential tremor, same thing is true. Anyone whose tremor is not controlled with medicines is a possible surgical candidate. In essential tremor, it's very much more straightforward than in Parkinson's. Really, anybody whose tremor is difficult to control will be helped by DBS and can really be a life changer for people with essential tremor whose tremor is not manageable. Okay. I am so sorry my videos are not working, but we'll see if we can maybe get some videos posted on the Genes or on the Temple website some other time after the talk tonight. So I'm sorry about that, but we'll see if we can try to get some posted. Briefly, how do we do DBS? This is, obviously this is a real big area of interest for everyone. The system is put in 2 operations. One operation places the wires, the electrodes into the brain. That's a very small surgery for the patient's body to go through, but it's a long operation. It takes about half a day. Someone stays about 1 night in the hospital, goes home the next day, and then comes back about a week or so later, a week or 2 weeks later, and has the second operation to put in the extension cord and the pacemaker. And that's an outpatient operation. It's much shorter, takes about an hour and a half. Once everything is put in, the patient is seen by his or her neurologist about a week or 2 later, and that starts the process of turning the stimulator on, turning the electrical signals on, and adjusting it to your individual brain, adjusting the stimulation to what your brain needs over the first few months after surgery. Sometimes that's very quick, it's very easy, 1 or 2 times. Sometimes it takes more adjustment. So, what I say to patients is the whole process of having this operation, the whole process of deep brain stimulation, from soup to nuts, from meeting your surgeon to having the device placed and turned on and adjusted, that whole process, figure that's going to take somewhere between 3 to 6 months. During that 3 to 6 months, we hope you are absolutely doing your regular life. This is not downtime, and we don't expect a lot of downtime after surgery. This is a surgery that's designed to keep you back in your life and active in your life the whole way through. So I'm not talking about 6 months of downtime, just a process that takes about that long. You may have heard, some of you may know that people used to have deep brain stimulation done with the patient awake for part of the surgery. If that sounds horrific or scary to you, you do not have to worry. I bring this up only to say that we don't do that anymore. We used to wake patients up and everyone got through it just fine, but it was not particularly fun. So we don't do that anymore. We do surgery in a standard operating room with the patient asleep. And what I'm showing you here is a kind of CAT scanner that we have in the operating room. It makes pictures just like the picture here on the right. And that shows us that we've placed those electrodes, we've placed those wires in exactly the right place for this patient. And so we know that everything is correct and in the right place before we leave the operating room. Okay. What is the safety record of DBS? So really important really important question for everyone. And one of the purposes for us to reach out to the community and do education sessions like this. There's no question that brain surgery is a scary thing. And there's no question that if you heard about this on the street and said, someone would like to do brain surgery to help with my tremor, you might run in the other direction. The truth about this is that deep brain stimulation has been around for a long time. This is a procedure that's been around for about 25 or 30 years. It is extremely safe and extremely effective. The risk of a major complication is about 1 in 1,000. The risk of a minor or a temporary brain complication is about 1 in 100. And then there are other minor issues. Sometimes we get an infection or things like that that are manageable. There can certainly be side effects from surgery. People can be confused for a little while after surgery. Sometimes there can be balance trouble after surgery. Sometimes there can be difficulty speaking after surgery. These things are usually mild, and almost always these are temporary. So I mention this just to say that we would never say any surgery is a free ride, and that everything is always perfect for every patient every time. But if we are going to be standing up here in front of a group of patients and saying a surgery will help you, we better be sure that the surgery will help you, and that this is something that we know we can do safely and effectively. And that if people do have side effects, they are things that we, by and large, can manage and get through. Almost every patient who we do DBS with, who joins us for this and goes through this process, almost every patient is glad that they went through the process. And I ask patients to be very frank with me about that and always try to be honest about it. There are people who have annoyances or side effects from surgery that bother them for a period of time. The vast majority of people wish that they had done this sooner, and find a real benefit to quality of life. DBS does not cure Parkinson's. It does not cure essential tremor, but it can cut down the symptoms of those diseases to the point that it's a real improvement in quality of life. And that's what we're after, is improvement in quality of life. Let's see, how are we doing on time? Okay, I think we're just about there. I just want to at least briefly mention the companies that do this. There are 3 companies out there that make deep brain stimulators. This is what they look like. Each of the companies has different pros and cons. That's a little bit of tech talk or inside baseball kind of conversation that we can talk about if anyone wants to, but basically they're all pretty similar. These devices are changing and advancing. Many people want to know, should I wait to do deep brain stimulation until better devices come out? And the answer to that is no, because even though devices are getting better, they're already pretty great. And then just to sum up and make sure we have time for questions, these are the main take-home points. Again, I know this was kind of drinking out of a fire hose. If you have Parkinson's disease, and also if you have essential tremor, if the medications for the disease do not control your symptoms, mainly the movement symptoms, the tremor and the stiffness, DBS is something that is probably helpful for you. It's a routine surgery, does not require being awake like we did in the old days. And it's a routine surgery with a very high success rate, very low complication rate. And for those of you who may be interested in DBS, or those of you who think that your symptoms may be responsive to DBS, it's something that we are encouraging people to think about earlier and earlier in the course of the disease, simply because we know that it benefits people, and we want patients to have as much time as possible with the benefits of stimulation. And so, and there's actually scientific evidence of this, that the earlier we do this in the course of a disease, the better it is for patients' quality of life.